HIV attacks healthy cells that serve as the body's defense. It can be contracted in 3 ways: unprotected sex with an HIV-positive person, sharing of needles, and mother-to-child transmission during pregnancy. In 1994, the incidence of HIV-related infections in the US were at 21.9%, with a mortality of 29.4% per 100 persons. National surveillance data showed reductions in morbidity and mortality of HIV patients. An HIV outpatient study was conducted from January 1994 to June 1997, with 1,255 participants from 8 US cities whose CD4 plus cell count were below 100 per cubic millimeter. Data from clinical visits on the prescribed antiretroviral therapies were examined and served as the basis for length of observation. Only deaths within 90 days after clinical visits were counted. Morbidity and mortality were compared through data of ART categories, taking consideration of patient demographics, risk factors for HIV infection, diagnosis, prescription medications, and lab results, including CD4 plus count and plasma HIV RNA measurements. After more than 42 months, the incidence of HIV-related infections decreased to 3.7%, and mortality among patients to 8.8% per 100 persons. The decline is due to thorough antiretroviral therapies administered routinely. Patients who were prescribed the therapy marked increases in the prescription of combination regimens containing protease inhibitors. This intensive combination drug treatment should be considered the standard care for these patients, along with optimal duration of the therapy. Those who have been infected with HIV can now benefit from proper treatment, thus reassuring the public health and safety.